Hi PP1 students, this is Professor Marcus. I have a debrief for you on the training OSCE that we did on venlafaxine for PTSD. I'm going to try to walk you through what my approach was, as well as do some screen captures showing you how I navigated the references. And a quick review of the grading rubric. You will get your some individual feedback by Wednesday of this coming week, but I thought I could walk you through the rubric so you could see what we were looking for. Have a quick revisit of this slide here, which was my advice for exam day. So first of all, of course, on exam day, you want to make sure you have everything available that you might need to complete the task, so you're not having to waste your exam time on that. That included having the library databases open, having the script available if you chose to use that, something to write with, and also knowing where the DISBAR examples are on the course. On the course, the examples and helpful things can be found in the course toolkit. I've compiled everything there from over the weeks, so you'll just want to find the section labeled drug information here, and if you go into this first folder, this is where we have examples and the blank script template, as well as right below it are those compendia finders. So by each question type, this is where it would show you, for example, where's the best place to look for dosing information in your compendia. So all of that is there, and I would suggest you have that open for the OSCE before you start. For the remainder of the video, I'm going to walk you through my approach of how I would have used the exam time under the suggestions that I gave you in our pre-OSCE session. So depicted here is the time and flow that I had suggested to you. In the session that I'm recording for you now, we're just going to focus on these items in orange. The items in blue you see are in low relief here because this is more related to tasks you would do on your own, such as recording your response and issues uploads. But I am happy to take any questions about those when we meet up on Tuesday. So let's start with looking at the prompt and classifying the question, which is going to direct how we approach answering it. So this was the prompt that all students received for the training OSCE. I'm going to go ahead and show you how I would have approached looking for the question information in it. So the first task is thinking about what is the question about, what question type or types is it. And as I'm reading this, usually you'll find a good indication of this will be in the stem of the question here. And what I can see is they're wanting to confirm if it can be used for this indication. So I'm seeing confirm, can it be used for this indication being PTSD. The drug is Effexor. I might have to look up the generic of that if I'm not certain. So I see that as a use question. And then the next part is really a dosing question, how to start it, how to get to an effective dose. I'd also likely use some of my reading time to focus in on some of the key DISBAR elements that I'm going to need to convey. So obviously I need to know who my requester is, Phyllis Vance, and I know that she's a PA. And my patient, Hugh Thomas, a 49-year-old male. Here's a little bit of his background as far as his symptoms. I can gather from this that it's been an ongoing problem for him, and it sounds like it's somewhat debilitating in that he's unable to get restful sleep and he's become withdrawn. So that tells me it's not just something that's likely to go away. And here's the official diagnosis that goes with it. And it looks like other history that I would probably key in on is normal kidney and liver function, so I'm not going to need to consider that for dosing. Otherwise in good health, so again, probably not a limitation on what we choose to do for them. And it looks like as far as other therapies, currently the patient is refusing psychotherapy, which is often given along with pharmacologic therapy. And no medication, so I don't have to worry about interactions. no allergies, don't have to worry about what medication we give to them, and it looks like the patient doesn't have any financial barriers to any particular medication that the prescriber might choose. So now I've used my reading time to classify the question, which is going to direct where I'm going to look, and also to highlight some of the key DISBAR things that at least come to my mind when I first read the case. So my next step is to go to my favorite compendia and spend some research time trying to make sure I address those two question types, which was usage and also dosing. So for the illustration purposes here, since most students seem to choose LexiComp as their first choice, I am going to demonstrate LexiComp first as far as where I would look. So since I already have LexiComp open, I don't need to take time doing that. I'm going to put in the drug name, and I'm going to scan my options here under Lexi Drugs, and it looks like the US brand name is my closest match. So I'm here to confirm use and also to look at dosing for PTSD. So in LexiComp, I would navigate to Uses. I can take a quick read here. I'm not seeing my topic under FDA approved uses, so I will start scanning, or you could Control F, looking for any off-label use. Do be careful if you Control F that you need to think about all the possible ways it might be. So for example, it wasn't listed as PTSD, it was actually written out here. But I can see that PTSD is an off-label adult use. And it looks like there is good evidence, and again, you can go to the evidence definitions if you don't remember what these categories mean. But I can see that there's been 2 clinical trials that looked at its use for PTSD for symptoms that sound, some of them similar to what my patient is experiencing. The re-experiencing or the remembering or having flashbacks, avoidance and numbing his family so that he has been more withdrawn. Also, in this section here, it talks about the place of venlafaxine in guidelines, and it does sound like it is supported in the guidelines, which matches with this category G here. And as I read through these details, they're saying it's effective and recommended, and the VA, who you can imagine probably treats patients with PTSD from wartime events, effective and recommended as monotherapy in patients who cannot or choose not to engage in trauma-focused psychotherapy. And that sounds very similar to the situation for my patient. So I've confirmed use. It can be used for this, and I can see that it's not FDA approved, but it looks like there is good evidence for it. So my next task is to try to find the dosing, which is what our requester also asked us for. So again, I'd be looking for my topic here. And here it is, post-traumatic stress disorder. I can see it's the extended release form, the initial dosing, 37.5 once daily, and then the titration is increased based on response and tolerability in amounts of less than or equal to 75 milligrams per day, no more often than every 4 days, up to looks like a max of 300 milligrams once daily, again, of the extended release. And here it gives me some additional helpful information about what was used in the clinical trials. So again, I would have gone there directly, but I would scroll back up and look to see if there's any other general dosing information that I need to consider at the beginning or the bottom. I'm not doing any dosing conversion, so that doesn't apply. At this stage, we're not discontinuing therapy, and while this is interesting information, I wouldn't provide it at this time because we're just starting, so I don't want to be talking about discontinuing. I would wait for that question to come later, nor are we switching antidepressants because the patient is currently not on anything. So that would address finding the 2 main elements in LexiComp. So in LexiComp, I have been able to confirm its use. I know both of its names, its trade name and its generic name. I found out it's FDA not indicated or it's off-label or unlabeled use, but it is well-supported effectiveness. For the purposes of illustration, in case you may have chosen facts and comparisons, I'm going to quickly show where to find that, since LexiComp and facts and comparisons often share information. These were our other things that we thought about, obviously related to the dosing. We'll see when we look in facts and comparisons that there's really nothing additional to add over what we found in lexicon. So in facts and comparisons, I would come here to indications. They have them broken up by FDA and then below it off-label. So again, if I was fresh at this search and hadn't just looked in lexicomp, I'm not seeing my PTSD here, so I would proceed on to off-label. And there it is. And again, very same exact information, almost looks like identical probably to what we saw in lexicomp. So I can see that it is has been used, is effective and recommended. However, it is not FDA approved. So my next task was to look for dosage information. If you recall, Facts and Comparisons lays this out a little bit differently, but they do have the same information. So under maximum dose, which is where they start the way they lay out their information, I'm not seeing anything specific to my indication. So I would also quickly look at the general dosing information at the beginning. Nothing appears to apply to my patient. This is not FDA approved, so I know I'm going to be drilling down until I find my topic. Here we are under off-label dosing, and now I'm looking for PTSD. There it is, confirming that this is off-label use, and the use instructions for dosing look identical to what we saw. So now that I have found the key information in my favorite compendia for what I believe addresses the questions that were asked of me about use and dosing, I would go back through my scenario one more time to see if there's any other details or things I need to look up now that I've kind of both thought about the scenario and also thought about what information specifically was available to me in the compendia, because perhaps I need to circle back and look for something else. This will also help me start to frame my script answer. So when I took a look back, what stood out to me again is that there's no interactions or allergies that I need to worry about, so I can take that off the table. Venlafaxine should be fine. There isn't anything related to the patient's, for example, renal function or liver function that would cause me to need to make a different dosing recommendation. The patient should be able to be put onto venlafaxine because there's no cost or formulary barriers to that. He certainly needs treatment because he's having persistent symptoms. And I can also get the picture that the patient is needing some pharmacologic monotherapy, or at least that's the direction the provider would like to go, and they are refusing psychotherapy. At this stage, if I was unclear, I may need to look up a little more information about the product itself. So we know it's going to be venlafaxine XR, so I could go into my favorite compendia and look and see what dosage strengths it comes at, and also what dosage forms. For example, is an extended release tablet, an extended release capsule, both, and what dosage strengths it comes in, because that will be important if I get asked any follow-up questions about the dose titration, for example, like what dosage sizes does it come in? Would we have to issue different prescriptions once dose titration needs to happen? My final step, if I happen to have any time left out of my budget before I start my recording, would be to cross-check in a second compendia if I have time. So as mentioned and shown earlier, if I had chosen Facts and Comparisons as my second cross-check, I would have seen that it confirmed basically everything I found in lexicomp, and there was really nothing new or different to add. If, however, I had started with micromedics or was using micromedics as my second cross-check, as we'll see in a moment when I pop in there with you, you will see that it does confirm the use and FDA status of venlafaxine for PTSD. It confirms part of the dosing information but isn't as detailed, and it does confirm the product availability information as far as dosage forms. There's one maybe a small additional piece of information that micromedics had that the other resources did not. So here in micromedics, I'm going to enter my drug name in the search field, and I like to use in-depth answers, so I'm going to navigate there. So I would start off, again, trying to confirm the use. Let's assume that I didn't yet know if it was FDA approved or not. I can see it is not listed in the FDA listing, so I'd go to non-FDA. And here is my usage information. So looking confirmatory, not FDA approved, but does appear to be useful and proven in clinical trials for that purpose. For dosing, I would go to adult dosing, and I would read the initial information to see if it's anything I need to be aware of. Don't see anything. It's basically about warnings of certain drug interactions, which we know is not an issue for our patient. So then I can start looking again for my treatment-specific indication to find the dosing. And here it confirms it's off-label dosing, extended release, and it gives me here a range of 75 to 300 milligrams per day orally. And it tells me what the mean dosage had been. If I followed these references, I would see these were probably from the clinical trials. So you can see how this is less detailed as far as the initiation, titration, and you have to assume that the 300 is the max dose based on how it is worded here. So the one other piece of information that this reference contains that the others did not is this section called Place in Therapy. And in here it talks about basically the role of venlafaxine in different disease treatments and whether it's considered, for example, a first-line drug. Again, the only piece I see here that's related is this very last line that suggests that it might be useful in the treatment of post-traumatic stress disorder. However, more research is required to determine its role in these disorders. And that seems compatible with what we saw as far as the use, non-FDA use indication as far as its effectiveness and literature support. So that wraps up how I would have budgeted my time and looked for the response for this particular question. I'm going to now put onto the screen for you the actual grading rubric so you can see how it was scored. So I'm displaying here the rubric. Again, just to reorient you, this top part is just the facts of the case that are provided to the grader. You can see that for this particular scenario, there were 16 elements that we were looking for, and students were either scored on whether they got that element or not here on the checklist. Each criteria is described here, and it tells you again in parentheses if you needed to get all of those or just a certain number of the available options that are there. So I suggest you pause here so that you can review the rubric more closely and come with any questions you have to our session next Tuesday. Thanks and have a great day.